For now, we're going to transition into our discussion with a couple of our patients on survivorship and their path towards that. I'd like to just ask Kathy Daly to come up and Paul Cheek to come up. This is going to be led by Dr. Asher, but as I've learned more about it, I think it's something that physicians talk to each other about. Please have a seat. And the patients can feel more comfort in talking with each other about. So I'll step away and let you lead.
So we all hooked up. Okay. So would it be helpful if you don't mind introducing yourselves and your story, and maybe we could talk about some kind of common challenges in the survivorship arena? But
Hi, I'm Kathy, and patient of Dr. Hamid's, and I had melanoma. I was diagnosed in 2011 originally, and had surgery, and we thought it was all good, and then it came back, so I ended up going to the clinic, and I went through a clinical trial, and we don't know exactly what I got, but we think it was a combination of Yervoy and Ipi, and so I went through 2 cycles of treatment, and then it became too toxic for me, so we went off treatment, but then I've been followed with scans, and at this point it's been 4.5 years since I had any kind of treatment, and doesn't seem to be any cancer anymore anywhere in my body, and I still work full-time. I've gotten married since I had treatment, and I have 2 granddaughters now, so it's all good.
My name is Paul Cheek. My dermatologist first found my melanoma on my left arm, forearm here, and said you need to go to a melanoma surgeon. I wasn't sure. I asked my dermatologist, well, where do I go? And she said there's one at UCLA and there's one at UCI, Dr. Jackowatz. I live in Seal Beach, Orange County area, so I went to UCI. Started my treatment there. They removed the tumor, and they said I was high risk for it coming back, so they put me on a wonderful medication called interferon. I was on that for a year, made me feel like poop for a year. Then for 5 years I was cancer-free. So after the 5-year period, they did a routine chest x-ray. They found a spot above my lung. The PET scan revealed I had 4 tumors in my body, so I went from stage 2 to stage 4 over a 5-year period. Started me on Opdivo, and 3 tumors went away within about 6 months. It was amazing. And I had 1 tumor in my abdomen, my lower abdomen region, that just wouldn't go away. So they did a Yervoy Opdivo combo, and then still wouldn't go away. They removed it surgically. My scans or about 2 months after my surgery, I was cancer-free. So I've been cancer-free for about 2 years, but after they removed the tumor, I stayed on the Opdivo for another year. My oncologist at UCI left, Dr. Sender, and he said, you need to go to Angeles Clinic and start being treated by Dr. Hamid. So I've been coming here ever since, and it's been great.
So the first question I'd like to at least start with is, we just heard from Dr. Hamid's slide about how common it is to experience anxiety when we're thinking about either fear of recurrence or when we're getting ready for the next scan. What words of advice do you have when you know you're about to have a scan in the next week, or you've had the scan and you're waiting for the results? How do you manage that time in those moments? What was helpful for you?
So many things. I think keeping active, trying to be as normal as possible, like you were talking about earlier. I continued to work, the whole time, and I have family, and I exercise, and I just put a lot of faith in what they were doing, because they gave me so much hope. The minute I got there, they told me that I couldn't have come at a better time. When I went through surgery, that was 2011. When I went through treatment, it was 2013, and they said, in a weird way, you came here at the exact right time. If you'd come any sooner, we might not have had some of these treatments available to you. And so that put a whole new perspective on it for me, like, wow, okay, it's weird that this is happening. I'm not happy about it, but it's a good thing that I'm here at this particular time. So that helped me a lot. And all of the staff, they made me feel like this place is the right place to be. We've seen miracles happen here. The first person I met was Brianna Hofcenter. She's a nurse practitioner. And I told her, the first oncologist said, I only have a year or two to live. And she said, oh, that's so 2012. She was just like, and that just made me feel so much better. I can't even tell you. But I also think that, when you're going to go through a clinical trial, you don't know what you're getting exactly. You just it's kind of like you're going to Vegas. You're going to just roll the dice and you're just going to go for it. Do whatever you have to do. They told me don't get a flu shot, so I didn't get a flu shot. They told me, he said, no alcohol. I said, okay, that's fine. I think if he had said stand on your head for 3 days, I would have done it. Anything that would help make it a better process, I was willing to do it. Yeah.
Thank you.
I looked at the whole cancer journey, if you want to call it that, is not me or I, it was we. And it was my support team, my family. Part of the team is your co-workers, your doctors, and a big part of the team is the infusion nurses. They're like the backbone of the cancer treatment realm. And when I was getting ready, she says, yep, coming up for scans, and they were always positive. And I just always thought, I'm going to have a good outcome, because doctors and said, hey, your things are going the right way, you're doing well, and you're going to get there. I was still nervous, a little afraid, but kept going. And I started to exercise again after my surgery, and really seemed to help. If you guys haven't subscribed to a magazine called Coping with Cancer, it's amazing, and it has all kinds of articles on, and one of the big articles was physical fitness, and it doesn't have to be a lot. Just walking, yoga classes, anything you get into really helps with the stress and everything else. Hope that answers your question.
And if I could piggyback on that, obviously I'm biased as a rehab person, but there's been an incredible body of research showing that, number one, when you exercise regularly, it helps us manage stressors. So there's less of a stress response when we're maintaining fitness levels compared to when we're not. But particularly for issues which are very common for many, like cancer-related fatigue, exercise probably is the best medicine that we have for that. There aren't really any drugs that manage fatigue in the same way. I will mention, since many of you are within the Cedars-Sinai system, we do now have a 3-month cancer exercise program where we tailor a program that's meant to address whatever your personal circumstances may be. That's something you may want to take advantage of if you're geographically in the area. So if we could kind of go in a different direction. So you mentioned having been married after all this. This is, I think, something we don't have great kind of guidelines on. When do you tell someone, let's say if you're dating, that I've gone through cancer? Do you tell them right after the outset? Do you wait? And how long do you wait? And when do you kind of expose those vulnerabilities to loved ones?
I did it immediately. The day I got my stage 4 diagnosis, it was Friday the 13th, of all things. And at the time, my fiance said to me, "Oh, I was going to go see this oncologist." He said, "Oh, don't worry about it. You're going to be fine. You're fine." And I just knew something was wrong, So I saw this oncologist, and he told me I was stage 4, and it was really surreal. I just felt such an out-of-body experience, and he said even with treatment, I probably only had a year or two to live, and I just thought, that can't be right. That just doesn't seem right, So I went out to my car in the parking structure. I called Ron, and he just, he burst into tears. But I felt like he needed to know right away. And I didn't see any point in delaying, telling him. But he's an amazing person. He was there for me every step of the way. I think that's a really important thing you touched on. It's like you've got to have somebody in your life who really will step through this journey with you. He went to every single appointment with me. He would joke around with Dr. Hamid and the staff and everything, and he just helped me. It was so good to know that he was there, even if I was in the infusion room and he was in the waiting room, I knew he was there, you know, and so yeah, I pretty much spilled the beans immediately.
And you're echoing again the importance of trying to manage loneliness and the feeling that we're going through this alone. I think it's worth trying to provide strategies for those who may not be in the same situation where they have someone by their side. And by the way, when you look at the loneliness research, you know, one could be married and still feel lonely. Or one could have lots of people around them and still have that feeling of loneliness. So it's not the quantity of the relationships that seems to matter in terms of medical implications, but again, the quality and the perception of that. So what do you guys think? How can one reach out and connect when we're not lucky enough to have a spouse already there?
That's hard because I have a friend who's diabetic and she has severe heart problems and she doesn't have a partner. And what I'm noticing is she's not doing the things that the doctors are suggesting she should do, and she doesn't ask questions. I think if you have the right doctor, you feel comfortable to talk to them about anything and ask questions. I think you need to make a patient feel empowered to ask and offer them alternatives, you know, and especially if somebody they're not going to ask on their own. I think it's important to push them, you know, ask questions, ask for help. It's a hard thing to do when you feel like you should do this all on your own, but you do need to ask for help sometimes.
I mean, I've been married 35 years, and I'm not sure. I think if I was single, maybe go to the symposiums, you know, get to know somebody. One that was cool thing about Angela's clinic, because when you're being treated, you've got patients right next to you, so you develop relationships with these people. And man, we start texting each other, we call, you know, out for lunch every now and then. So it was pretty cool. Unlike whereas UCI is a great place to be treated, but you were kind of separated. And
I totally agree, and that really, and I think you both mentioned this, but I've heard this so often at Cedars and in other places in Angeles where how just the guy at the valet at the cancer center or the person that checks you in and your nurses and all the support staff, what a critical difference that can make. But if we're in a situation where we don't have someone in place, and I think you alluded to this, the importance of reaching out and asking for support, whether it's if there are social workers at your sites or you know, at Cedars we have like chaplaincy support and social workers, and in Los Angeles there's an organization called the Cancer Support Community that has all kinds of activities, and there are these symposiums. It's worth the investment, some would argue, to connect. To change directions a little bit, what was the biggest side effect for you both? And we could maybe think through how to manage common side effects related
Fatigue.
to melanoma treatment.
Yeah, fatigue is for sure. Yeah, I do remember fighting the fatigue, and I had so many weird side effects. I remember I was telling Paul about this muscle spasm that I was having. It grew. It started off just like a tiny spot in my back, and then it just grew and grew and grew. And there was a point where I couldn't stand up straight, and it has remained partially on the left side. And the funny thing is, when I'm a big believer in exercise, but when I exercise a lot, it does tighten up, you know. So it's just something you learn to work with it and live with it. But the fatigue, I know what you're talking about. It's a tough one, especially when you're still working, I think.
yeah, I get the fatigue. I'm a captain with the Long Beach Fire Department, so sometimes I think, well, we get up at night, but it's still when I'm home for a period of days. Every evening about 7, 8 o'clock, it just like kicks in. I just turned 60, maybe it's that. You know, and we were talking in the back. I try to hydrate. Here again, 60, go to the bathroom a lot. But that helps. The hydration is a big deal. And for some, it's tough. You know?
And if I could just piggyback on that, in our literature, you know, there is a magic number, it seems, to the exercise piece of how much exercise we need to try to reduce fatigue levels. And if I could just plant that seed, it's 150 minutes at least per week. of some kind of aerobic exercise to reduce fatigue. We didn't talk about this, and sleep is the other part of the equation, and I know many individuals have a hard time sleeping with some of the treatments, or because we're thinking about things over and over again. Did you have any sleep troubles, or do you? And what were, besides just Ambien, what other tricks did you have?
I was having a lot of hot flashes, and I was talking to them about what can we do, and, because I can't take hormones, obviously, so they gave me Ativan, and it did help alleviate some of the hot flashes. They found a study with breast cancer patients. Ativan helped breast cancer patients with hot flashes, so I tried it, and it was helpful.
So certainly there's a role for medications. And any other tricks?
I really didn't have trouble sleeping, but the fatigue, napping was key, taking a nice little nap in the afternoon.
Right.
I kind of do it at the firehouse anyway because we're getting up in the evenings, but it really helped a lot.
And if I could just pitch in one other idea that doesn't involve drugs, and the research supporting this is more in the breast cancer arena, so it's hard for me to know how much this extends. But there's some concerns that as a society, we've kind of mucked around with our circadian rhythm, which is our normal biological clock. And the feeling is that ancestrally, this was pretty well regulated because we'd be out working in the fields or hunting or gathering nuts and berries. And then when the sun set, it would be absent a few stars or the moonlight, it was totally dark. And having that duality of light and darkness really helps the circadian rhythm. It helps regulate the secretion of melatonin, which you've all heard of as a supplement, but our brains make these things naturally when we get those two things, light and darkness. And I think the challenge for many people who are going through treatment and their day-to-day routines are disrupted is we're indoor all the time, particularly if we've been told, understandably, to get out of the light because, we've had melanoma. But being inside all the time without any light and then being exposed to all these bright lights at night with city lights and iPhones and iPads and the LED lights everywhere, that may be adding to the insomnia epidemic that's occurring generally right now. And I don't know the associations with melanoma, but there are concerns that it's increased the risk of certain cancers in general, particularly breast and other cancers. So thinking about getting some natural light without undue exposure and burning yourself. And by light exposure, really mean through the eyes. That's what regulates the circadian rhythm. Coupled with darkness at night may be one non-medication approach that could be helpful. Okay, one more question, and if it's okay with Dr. Hamid, I'd love to get questions from the audience. How would you counsel individuals who might have concerns about self-image or intimacy after sometimes the surgery or if lymphedema develops, or just concerns about body image after going through this treatment?
That's a good question. I always tease my husband. I say, so glad you're half blind because, you can't really see what I see. I think we're all very self-critical in that regard. But we had been through a back surgery with him, and, we really bonded through that experience because he was in so much pain, a lot of things he couldn't do for a while. And so then a year later when I had my first surgery, he was really empathetic. I was lucky in that respect. But yeah, I think the funniest thing though is when I lost my hair, we didn't expect that to happen. And your hair grows back pretty quickly, so I had my head shaved, but within a few days you could see this stubble, but it was turning white. And I had been a brunette before, so I was looking in the mirror when I was getting ready for work, and I said, "What do I look like?" And he looked at me kind of funny. He said, "You look like a baby duck." And I said, "Yes, that's what I look like," And so I just started wearing scarves. It was January. It gets really cold when you don't have hair. You don't realize. And I started wearing scarves, and I went online and I saw all these videos about how to creatively, fold scarves and wear them. So I just had a lot of fun with it. I just started saying, okay, this is where I'm at, so this is what I'm going to do, and that helped me a lot, and everybody seemed to like it. So
I've got when they removed my tumor that was in my abdomen, I got a nice scar, but I got a little, because it cut through my abdominal wall, I got kind of a little bump there. And, you know, I used to be out in the sun a lot, probably why I got melanoma. And so sometimes it's self-conscious to me. But now when I go to the beach, I'm covered with an SPF long sleeve shirt, and so just gotta live with it. You know, I kind of call it my buddy. Remember the movie Total Recall? It's Quato. It's my little buddy right there.
I think that underscores, again, I think you both have an amazing ability to use humor and to kind of change perspective as a way of managing a common problem. We are lucky enough in, you know, being in LA that we have therapists that specialize in body image changes and sexuality changes for individuals that have gone through cancer treatment. And if some of the techniques that you guys talked about and we talked about earlier isn't enough, it's worth reaching out, because I know it can be a common concern for many. How are we doing on time? So if we have a couple of minutes, does everyone have a question really directed for our patient guests? Yes.
I've been coming to these seminars for a long time, and I'm a melanoma survivor also for since 2004. And I keep asking on those sheets where you fill in your opinions, why can't we have a support group for people who are going through this? I think that the people who screen at the Angeles Clinic do a superb job. They must get a sense, maybe by the first time you come, they take their time with you and they see who you bring with you. They can see what your support group is right there and then. So they tend to, at that time anyway, 10 years ago, they picked people who came with a terrific support person. But there are lots and lots of people who don't have someone like that in their lives. And so I keep asking for a support group for people who are going through the process, for people who have been declared cancer-free or in remission like I am for a long time, but who would still like contact with people like these two who could be wonderful mentors or leaders of a group like that. So I'm putting it out now out loud for the first time, because I don't know if anyone ever got those notes or paid any attention to them. So now I'm saying it out loud. Would be great if the two of you or people like you who have the time would want to mentor people going through the experience.
I think that's a great idea, because, you know, as you were talking about earlier, every patient is different. You know, no two people are alike. The way your cancer started, how it progressed, everybody has their own story. But yet there are some common experiences that we could share and help encourage each other. Because I think that was a big component for me, was I felt safe at the Angeles Clinic. I felt like I was in the right place. But you know, you have good days and bad days with treatment, and ups and downs with it all. So it would be nice to have somebody to talk to. And different people have different little bits of advice. My husband's cousin, she's a cancer survivor, and she told me about curcumin and turmeric, and she actually put together a care package for me. She went out and bought all kinds of little gifts, and she wrapped them all, just little things, you know, a chapstick or a magazine or whatever. But anyway, she said, when you're having a bad day, reach in this box and pull out a little gift for yourself and open it up, and it'll make you feel better, you know. And I mean, just little ideas like that. There's so many things we could share. So I think it's a great idea.
I think during my cancer treatment, as I mentioned, you develop friendships with other cancer patients. And as I mentioned, I'm a firefighter, and I was on this call one time where the call was female in her 30s having complications from cancer treatment. And I went to the house, and the patient was in her 30s, and I'm starting to do the report, and her husband's here today, Brad. And my job is I start the report, hand it over to the paramedic, and we ask questions. What's the patient's name? Write the address, the medical history, heart, so on. And I said, what kind of cancer? And he said, melanoma. And for the first time in about 32 years, I had to step outside for a second because I was in the middle of my treatment, just had my surgery. And she commented how cold she was. So a few days later, I stopped by, took her a fire department t-shirt, a beanie, and just reached out. And he mentioned that he had a friend that worked on the fire department. So I got their phone number and contacted him. And we became, believe it or not, this old guy, we started texting each other. How'd your treatment go today? How was I got scans tomorrow, I'm a little nervous. And God took her home. She passed away. But since then, Brad and I have become good friends, and we'll talk and hang out. And I know they said no alcohol, but we'll go have a beer. And, you know, so I think through the cancer journey, it's you can develop relationships and things like that. Just talking to her now, every time I see her at the Anderson Clinic, we'll strike it off. So I think that's a real that's something the Anderson Clinic has. It's a real, you know, when Dr. Hamid said, hey, you don't have to go up to treatments anymore, it's like, oh man, that's a bummer. You know, so.
I got a job for you, Paul.
Yeah. Where's the broom? Anyway.
But to that point, I think support groups are challenging, and I think it's entirely dependent upon who's facilitating it. Because, forgive my speech, I mean, sometimes they become bitch sessions, right? Where we just actually some people feel worse because we're just processing negative emotions over and over again. I will mention, you know, the cancer support community in West LA and WeSpark and Sherman Oaks. Tower Cancer Research Foundation in the Beverly Hills area, they do have some support mechanisms that might be worth looking at. We could talk about that. Was there one more question?
I have a question.
Yes.
I was given 2 years to live, and that was almost 12 years ago.
Yeah.
I have a very positive attitude. I didn't have anything to do with it. I have a very positive attitude, but there's not a day that goes by that I don't think about dying. Maybe that has something to do with my age and not melanoma, but when they tell you that, it's hard to forget. And I'm wondering if you've been through that, and is there a way to make it every other day?
Yeah, absolutely. You do think about it. When someone looks you in the eye and says, you know, like that doctor told me, you only have a year or two to live. But you know what? Doctors are human beings. They can be wrong, you know. And what I felt, I was pretty devastated, and I had a really crappy weekend. And then something clicked mentally, and I said, I'm not ready to leave, you know. So I just felt certain there was some other purpose for me to be here, and so I try to focus on that. Of course, I know I'm going to die. We all have an expiration date. You know, my boss is a melanoma survivor, and she said to me, none of us is getting out of this alive, you know. So we all know it's out there, but I think more importantly is to focus on, like they talked about in the slides, being of service, being helpful to others, loving people that you're with, whoever you're with, you know. My boss is an amazing woman. She's a crazy person sometimes, but she's an amazing person. And so I try to focus on the whole person instead of getting mad at her for petty little things, because it's easy to do. But I try to focus on the whole person and the whole purpose of being there. And I try to focus on the gratitude. I work at Paramount Studios. It's one of the most beautiful studios you'd ever see. It's in the heart of Hollywood. There's a wealth of history there. So I try to celebrate things like that every day. Just the fact that I drive into those gates every day, that's amazing to me. And my husband is amazing to me, and my grandchildren. I mean, there's just so many things, so many people that have come into my life. And another thing I wanted to touch on too is I'm so grateful to all the people that prayed for me. There were so many people praying for me while I was going through this, and really, really wanting to see me get better. And I try to pay that forward too. Anytime I meet somebody, you know, I try to, whatever it is they're going through, I try to focus on the positive aspects of them, of what they're going through and how they're surviving it, rather than, oh my God, this is horrible and, you know, we could die. Of course we could die, but guess what? There's so many other great things happening, so why not focus on that?
I don't know, for me, I really haven't thought that. When Dr. Cinder, my oncologist I had at UCI Medical Center, said, "Hey, Paul, your scans show 4 tumors," and I just said, "Well, what can we do to beat this? Where do we go from here?" And I knew it was going to be a long journey. Before my surgery, my wife and I got together and redid our trust and made sure everything was ordered in case something happened. And when I was signing those papers, I was thinking, "Man, this could happen." Mm-hmm. And I had a friend call me. He had a melanoma. He said, "Well, you know, Paul, you had a good life." And you know, so you know, I did think about it, but I don't anymore. I think like she mentioned, we've been blessed with having a melanoma at this time. In 2010 is when I had it. 2012, all the immunotherapies came on. Very, very fortunate, you know. So I kind of look at it as maybe we can touch other people now and help them and go forth with that. And I hope that answers your question. I don't know.
There probably isn't one answer that's going to work for everyone. One analogy I sometimes think about when Shimon Peres, he was I think the Prime Minister of Israel or the President of Israel, when he died, and I was reading some of his obituaries, they would kind of recount stories about him driving into the West Bank, and he would not infrequently get shot at. You know, his car would get shot at, and he'd be either on the phone or talking to someone with supposedly the sole purpose of trying to negotiate some kind of peace deal. And apparently, he was so immersed in what he viewed as life mission, which was to negotiate peace, to find peace, that he kind of forgot about the fear of the gunshots. And so that's just another example, and I think you both spoke to it so eloquently, that if we try, and again, this is much easier said than done, to redirect our intentions towards what we think is our source of meaning and purpose, that even if we don't eliminate fear, it may be a little bit more in the background like it was for him, for example. Okay, so I think at this point, we're stopping.
I have one question from somebody who's live streaming.
Okay.
If I can jump in, please. She writes, "I'm a young mother of a 10-month-old with stage 4 metastatic melanoma of the liver. What kind of mindfulness techniques or coping mechanisms should I look into?"
So again, there's no easy answer in terms of a formula or like a specific drug. One of the great advantages of what's called mindfulness-based stress reduction programs, the abbreviation is MBSR, is that it's relatively standardized and you can get it virtually anywhere. So there are online versions of this, and it's been shown over and over again in the cancer setting as an important tool to reduce a lot of the things that we've all been thinking about, whether it's fear or the unknowns or dwelling on tomorrow. It does take some practice, so the typical program is about 8 weeks. If we just did it for those 8 weeks and stopped, it probably wouldn't stay. But one of the amazing things that I came across recently was a study where they employed this mindfulness-based stress reduction program, and they looked at the scans of their brains to see what kind of brain changes occurred. And the part of the brain that's associated with fear, it's called the amygdala, actually shrank in activity. So they actually see with these functional MRI scans or PET scans decreased activity in a part of the brain associated with a fear response, and that occurred in just 8 weeks. And one of the things I first thought was that, well, great, you know, if I'm doing 30 minutes of mindfulness, maybe I'll have less anxiety or fear during those 30 minutes. But it turns out that if you practice this long enough, the benefits really can be maintained over time. So it can be maintained the rest of the day, even when we're not in that 20-minute practice.
There are also a number of apps you can have on your phone. I have Calm and Headspace, And it just helps you to be able to meditate and have that quiet time and mindfulness for those that can't go to a support group or join a program that goes on for 8 weeks. And a young mom might be able to benefit from that.
Thank you. Absolutely. And again, the MBSR programs are available online with apps now, which is, again, why it's so much more feasible than it used to be. Okay. So I thank you both so much for
Thank
your
you.
stories.